Today's episode of Knoxville Medicine Doc Talk is sponsored by London and Amburn, Attorneys at Law, Healthcare People, Healthcare Law. London and Amburn, Attorneys at Law, are proud to support the Knoxville Academy of Medicine and its mission to continue to improve community wellness in East Tennessee.
Hi there, welcome. Thank you for joining us today to Doc Talks, where we talk plainly about medical conditions that affect all East Tennesseans. I'm Dr. Elise Denaney, former president of the Knoxville Academy of Medicine, and I'm glad you're able to join us. Today we have talking with us Dr. Larry Kilgore, who is the professor chairman of the University of Tennessee Gynecologic Oncology Department. That is a mouthful, promise me, and he'll explain what that means. He's just a great guy who's going to talk plainly about cervical cancer. So, welcome, Dr. Larry Kilgore.
Happy to be here. Happy.
What did all that mean?
So, as way of introduction, I'm a GYN oncologist, so I'm a cancer surgeon, if you will, for the reproductive cancers for women. We'll say from the waist down. Uterus, cervix, ovary, those types of cancers, and then and their prevention, and setting the standards and guidelines for screening for those cancers when we can. That's what I do.
That's great. You know, we're so lucky, especially in cervical cancer. If we catch this and screen for it, we can avoid mutilating surgery, we can avoid losing organs in our body. We just need to see you on a regular basis.
And losing your life. It is a terrible problem worldwide. We've made great strides over the last 50 years in America with the pap smear screening. But we still have regions of the country that have terrible problems with screening, lack thereof, understanding what the screening is, getting it done. And then we have some risk factors that are unique here in East Tennessee that we really struggle with. So this area of the United States, if you look at a map, would not be favorable. This is a very high rate area of cervix cancer and also a high mortality rate from cervix cancer. It's terrible. So
mortality meaning we die.
We die from cervix cancer, right? Yeah.
Okay.
Right.
And so risk factor meaning that if this is present in my history, I'm more likely to get cervical cancer.
The risk factors, right?
Yeah, so is tobacco one of them?
You hit right on it. We'll talk, I'm sure, in a moment about the actual cause of the cervix cancer, that being a virus that we can prevent in young women.
How do we know if we have the virus?
So the virus is something we can test for. We actually don't start testing for it until a woman reaches the age of 30. But all of us, male and female, basically are exposed to this virus through sexual activity. Whenever it is that we begin sexual activity, and you know, some people begin in their teens in high school, and some unfortunately are exposed to sexual activity by force at younger ages. But whenever that occurs, hopefully by choice, that electively we choose, we are at risk to be exposed to the virus. And essentially all of us, at least 90% of us, come in contact with this virus called the human papillomavirus, or known better as HPV. HPV. And when we come into contact with that, there's no immediate harm. You don't know it. It takes a little while for your body to clear it, because it doesn't get into your bloodstream or anything like that. It's always on the skin. And so it takes a lot longer to develop a resistance to that virus if it's just a skin virus. In this case, the skin being the skin in the cervix and the vagina for the female. And so we're all exposed. By age 30, about 90% of us have developed an immunity to it. And that's great. That means we're not going to get cancer from it and so forth. But that's a long time between exposure at, say, 18 maybe younger, and 30. Then before we develop an immunity, so some things can happen during that time, and that's what we screen for.
Okay, so the sexual activity, does it include, so if your partner, I know some people have HPV in their mouth, so can they transfer that to a girl, a woman?
Yes, right. So you can acquire the virus or transfer the virus by intercourse, by touching genitalia, transferring it by hand or fingers, and then certainly by oral sex, male and female. So it's not just cervix cancer that we see with the HPV virus in women. It's also related to anal cancer, and it doesn't require anal intercourse, but anal cancers, and then head and neck cancers, especially if you combine that with tobacco, smoking, or in the male case, men can have cancers related to their tonsils and their tongue and throat, and also penile cancer and anal cancer, especially if they engage in anal intercourse.
Right.
So it's basically all the things we use for sex,
Right.
including our hands and mouth and genitalia, all are exposed to HPV. The key is to have an immunity to it. And then if you choose to engage in those sexual activities, then you have protection.
Excellent. So I want to be immune. I want to have my defenses up so I won't get cancer. And how do I get immunity?
Okay. So you can acquire the immunity on your own, and that's the way the majority of patients have developed immunity. They're exposed to the virus, and their body eventually, and it may take a few years, but will eventually clear that, hopefully before something bad has happened. That's the problem. So it is a wonderful development that we have a vaccine that is available for men, boys and girls, beginning at age 9, hopefully before they have any sexual contact, ideally around age 11 or 12. At that age, it's just 2 shots, 2 months apart, a few months apart, and then they then have immunity to that. So when they are exposed to the virus later in life through sexual activity, they can clear it before any bad things happen.
That's great. So the principle of that and how it works is like a flu shot. We get a flu shot to help us get our defenses up in case we encounter the flu virus. And this way, with those 2 shots, we have our defenses up in case we encounter the HPV virus.
HPV virus. And we must say that the age range is now all the way up to age 46. Just recently been expanded for this vaccine. It was only covered by insurance up between ages 9 and 26 until the last few months, when it was then approved all the way up to age 46. And so you can get coverage, health insurance coverage, or you can pay out of your pocket if you want to acquire this. So the ideal person is prior to exposure, like before you get the flu, before you get HPV, have the vaccine. But there are many women and some men that are in their 30s and they were not vaccinated when they were young. Wasn't available for many. They may have had only one sex partner in their life, their husband or wife, and they may lose that spouse either through death or divorce. And then they begin dating again in their 30s. They're naive to the virus. They've never been exposed to it. So these women are great candidates to come in for the vaccine as well.
Okay. How, up to what age we can?
Age 46.
Age 46, that's men and women.
Right, exactly, right.
Okay,
Yeah.
all right. Okay, so we get the vaccine. How do we, if we're worried that we have it, is there a test that we can do that will tell us if we have HPV in our body?
Yes. So there's a test beginning at age 30 for women with their pap smear. The pap smear is taken, but also from that sample there is a HPV test that's done as well. So if you have the virus in your vagina or cervix, that test catches it 99% of the time. It's a very accurate test. The good news is if you have a negative test, you do not have the virus. And so that means you have immunity to it or you've never been exposed to it. If you're tested positive for the virus and you're over 30, you probably have never developed immunity to it, and it's going to be there for most of the rest of your life, if not all your life.
Okay. There's no cure for HPV.
That is correct. There is no treatment for HPV and no cure. Although, at the University of Tennessee, just starting this past month, we have a clinical trial for a therapeutic vaccine. It's under investigation right now, but it will eventually be approved. And this would be for those people who have HPV chronically, the 10% of the population, and they can get that therapeutic vaccine and then have the immunity to it and clear that. So the vaccine that's available now is prevention and develop it before you're exposed. And the therapeutic vaccine, which is coming in research right now, will be for those patients who have it chronically.
So with vaccines in our world today, everybody's so fearful of getting a disease from getting a vaccine. Can you get HPV from the vaccine?
No, you cannot. You cannot get HPV from the vaccine. It's a very safe vaccine. The only registered complications from the vaccine, and literally hundreds and hundreds of thousands of young boys and girls have been vaccinated with this, is a sore arm from the shot, right?
Okay.
Yeah,
right.
It's a little soreness there, but no major complications have been reported.
So parents should protect their children by starting and considering doing that vaccine. Can they get it from their pediatrician?
They can get the vaccine from the pediatrician, and some OBGYN offices have the vaccine, certainly for the adult women, and they are in their offices. But the pediatricians see the kids, and they have the vaccine available. It's not required for school. That's an arguable point that many of us would like to see. Some countries do require it, like Australia, where their vaccination rates are like 98 to 99%. And we're seeing their cervix cancer rates go down, their precancer rates go down, their genital warts go down, because the virus is, it's leaving. It's not, everybody has immunity to it. So right. When that happens, it's good news.
It is excellent news. All right, so we mentioned one thing about cervical cancer. Should we get screened every year for cervical cancer? Well,
that's what your grandma did, and that's what your mother probably did. Go to the doctor once a year, get a pap smear, and there's nothing wrong with that kind of education, except that now we don't need that many pap smears. Now it's 21. And in your 20s, you need a pap smear every 3 years. You don't need the HPV test in the 20s because literally, unfortunately, there's so many patients that are positive for the virus that we can't screen them all.
Okay.
But at 30, only 10% of women have the virus chronically. So we begin at age 30 to test the pap and the HPV test. We do both. And that's done every 5 years if they are both negative. So after 30, you're screened every 5 years. In your 20s, you're screened every 3 years. There's also an opportunity to just be screened with the HPV test. And I think in the next few years, we will have women testing themselves, basically at home with a kit. They'll test for the HPV virus. If they're positive, they'll come in for a pap smear. If they're negative, they don't require a pap smear. So you can have the HPV test only beginning at age 25. So the guidelines are confusing because they're changing to adapt to what's needed. So your physician should know. I think it's still a good idea to consider going in annually if you're a woman to converse about a variety of things. It might not be just the pap. It might be sexually transmitted diseases or contraception or any number of things. At that visit, do I need a pap smear? The doctor should say, nope, you're not due, or yes, you are. Do I need an HPV test? You're not old enough for that yet, or yes, you do. And that answer can be given when you're there.
You hit the nail right on the head, because I was listening, I was going, wow, okay, under this situation, these are the guidelines. Under this situation, these are the guidelines. I'm thinking, I'll just ask my doctor.
And many websites have those guidelines as well.
Okay, I really appreciate you coming in. Go ahead.
I wanted to talk, just if I may,
yes.
Briefly about East Tennessee and our particular risk here. So we have some of the highest rates of cervix cancer in the nation, in our region, in Appalachia, and some of the highest death rates from cervix cancer. And why is that? One is access to care. Many of our patients that we serve are uninsured, and many are poor and have limited ability to get to see us for screening. That's a big risk factor for young women. Secondly, a lot of our women in East Tennessee smoke, and we have very high rates of smoking in our young women in East Tennessee. Those are deadly combinations. If you smoke and you're young and you can't get to the doctor for screening for cervix cancer, then you're at risk to have it, and since you don't come in, when you do finally come in with symptoms, that's really bad, because we see many advanced cases of cervix cancer in East Tennessee. It's astonishing, and the majority of those women we cannot cure. And so these are 30-year-olds, 32, 33-year-old. These are not 70-year-old women. These are young women. It's a big problem. So awareness of screening, getting in for screening, knowing about the HPV virus. Please, if we could get everybody vaccinated when they're young, and our vaccination rates in East Tennessee are only about 30%. We need to improve that, and then we can make a dent in this terrible disease. It's awful.
There's a lot of room for improvement at 30%. I'm so glad you have a heart for helping young women. Seems like we're always advocating for them. Young women who have limited means to avoid something that could be potentially mutilative, you know, and change their life going forward. So if you have any problem with access, you're always welcome to call the Knoxville Academy of Medicine. We have Knoxville Academy of Medicine Project Access, and have a lot of knowledge about resources where we can direct young women with limited means to get the care that they need, because it matters and you matter. So thank you for joining us. If you have any other questions, how can we get a hold of you?
So you can reach us through dialing the number at the University of Tennessee Medical Center and ask for access to me, Dr. Kilgore, or GYN Oncology, or Women's Services, or Healthcare. There are a number of very good OBGYNs there, and who can see patients of any age, and so we'll be happy to help.
Okay. Thank you again for joining us this afternoon. We hope you enjoy good health and have a safe holiday, and that's a wrap.
Today's episode of Knoxville Medicine Doc Talk is sponsored by London and Amburn, attorneys at law, healthcare people, healthcare law. London and Amburn, attorneys at law, are proud to support the Knoxville Academy of Medicine and its mission to continue to improve community wellness in East Tennessee.